Ozempic or Mounjaro weight loss may feel noticeable before it looks noticeable. Appetite can change during the first week, while the scale may need 4 to 8 weeks to show a clear trend. Clothes and waist size often change later. The most useful answer depends on dose increases, starting weight, food intake, individual response, and whether early scale changes reflect fat or water. Timing starts with the drugs themselves. Ozempic contains semaglutide, while Mounjaro contains tirzepatide. Both are weekly medicines for type 2 diabetes, with other brands for weight management. They reduce hunger, increase fullness, and help many people eat smaller portions without constant effort. The word noticeable can describe 3 different changes. Hunger may ease first, the weekly weight average may fall later, and visible body changes may take longer. 2 people can therefore report different timelines, even when treatment is working normally for both. The distinction is between a normal waiting period and a pattern needing closer review. It prevents panic after 2 slow weeks and months of ineffective treatment from being ignored. The first change many people notice is not weight. It is less food noise, which means fewer repeated thoughts about eating. A usual portion may suddenly feel too large. Snacks may become easier to skip, and stopping halfway through a meal may feel natural. That appetite change can appear within days, but timing varies. Some people feel it after the first injection. Others notice little until a later dose. A stomach side effect is not proof the medicine is working, and no nausea does not mean failure. The mechanism explains the delay. These medicines copy gut hormone signals that reach the brain after eating. Those signals strengthen fullness and reduce hunger. They also slow how quickly food leaves the stomach, especially early in treatment. Less hunger only changes body fat when it lowers average energy intake. One small dinner does not create visible fat loss. Repeated smaller portions create that gap over several weeks. The body then draws from stored fat, and the trend becomes measurable. The scale can still hide that process. Salt, carbohydrate intake, constipation, menstrual changes, and a late meal can move weight by several pounds. One morning can therefore look disappointing even while the weekly average is falling. Because short-term noise can hide the trend, measure consistently. Weigh under similar conditions, preferably after waking and using the bathroom. Compare weekly averages rather than single numbers. A waist measurement every 2 to 4 weeks can reveal progress that daily weight misses. During weeks 1 through 4, appetite change may be the main sign. A clearer weight trend often becomes easier to see during weeks 4 through 8. Mirror or clothing changes may take 8 to 12 weeks or longer, especially when larger losses are needed before changes become visible. A dramatic first-week loss can be misleading. Less carbohydrate and sodium can release stored water. Smaller meals also reduce food inside the digestive tract. The scale may drop quickly before much body fat has actually changed. The reverse can also happen. Constipation, fluid retention, or a restaurant meal can hide fat loss. These effects can outweigh several days of progress. Over 3 or 4 weeks, short-term swings often cancel out and reveal the true direction. Even when the trend is real, starting weight changes what noticeable means. 5 pounds may be obvious on a smaller body, but remain hidden on a larger frame. Percentage change is more useful. A 5% loss can improve health measures, but visible change still varies. Consider 2 people who each lose 6 pounds. One started at 160 pounds, while the other started at 320 pounds. Their scale losses match, but their percentage changes do not. The first person lost nearly 4%, while the second lost under 2%. Starting weight affects when changes become visible, while dose timing affects when appetite and weight changes begin. Ozempic commonly starts at 0.25 milligrams weekly, then increases after 4 weeks. Mounjaro commonly starts at 2.5 milligrams weekly, then increases after 4 weeks. Faster dose increases may seem tempting, but they are not a shortcut. They can intensify vomiting, diarrhea, constipation, or dehydration. Severe symptoms can reduce food intake briefly, but that is not healthy fat loss. Dose changes should follow your prescribed plan and stay within what your body can tolerate. Even with proper dose increases, early responders are not guaranteed the best long-term result. Slow starters are not automatically poor responders. Trials measure outcomes over months because dose increases and smaller portions need time to affect weight. Food choices can also hide an early response. Liquid calories, alcohol, grazing, and high-calorie snacks can slip past reduced hunger surprisingly easily. The medicine lowers hunger. It does not make every calorie disappear. Judgment starts with the percentage of starting weight lost. Next, check the waist measurement. Then notice whether hunger, portions, and food noise have changed. Together, these measures show whether treatment is changing eating and body size. Before judging the response, confirm that the dose was taken correctly. Missed injections, poor storage, pen errors, or repeated pauses can weaken results. Then judge the timing. Do not judge the full response during the starter dose alone. Review it after dose increases and several weeks of consistent treatment. Beyond correct dosing, protein and fiber help smaller meals stay filling. Protein helps protect muscle during weight loss. Fiber supports fullness and regular bowel movements. Meals containing both can reduce random snacking without an extreme diet. Movement supports progress in a different way. Walking can increase daily energy use and improve blood sugar control. Strength training helps preserve muscle and daily function. The scale may move slowly, but more of the loss can come from fat. Those habits support weight and blood sugar, but the results may still move at different speeds. Lower blood sugar may reduce thirst and urination in people with diabetes. However, better blood sugar does not guarantee large weight loss. These outcomes are related, but they are not identical. Other medicines can change the scale. Insulin, steroids, and some medicines for mood or sleep may promote weight gain. Poor sleep and low activity can also slow progress. Untreated sleep apnea interrupts breathing during sleep and can increase daytime fatigue. Medication effects, poor sleep, and low activity can explain slow progress, but severe symptoms are a different problem. Contact your doctor when vomiting persists, fluids will not stay down, or severe abdominal pain develops. Separately, low blood sugar risk rises when insulin or insulin-releasing pills are used. When red flags are absent, review a slow trend step by step. If appetite never changed, check the dose, injection technique, and missed doses. If appetite improved, but weight did not, review drinks, snacks, other medicines, and sleep. Repeated side effects may interrupt treatment and weaken the result. This sequence shows whether the medicine has little effect, eating patterns offset it, or treatment interruptions hide progress. Keep one simple record of weekly averages, waist measurements, appetite changes, and dose dates. Bring it to your doctor if none of these measures changes after consistent treatment beyond the starter dose. Judge the process by more than speed. Look for a falling weekly average, a smaller waist, easier portion control, and a tolerable treatment plan. The best response is not the fastest first week. It is meaningful fat loss that continues without preventable harm. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.